Welcome back to Las Vegas Now. As we get older, our health needs change and exercise and diet becomes more important than ever. I spoke with a doctor at Southwest Medical today to learn more. Here's our conversation.
All right, so let's talk about healthcare for older adults. First things first, where do older adults need special attention?
You know, it's a great question, and I think as we've been in this self-isolation for a few months, I worry about our older adults and their lack of activity through that time. And a lot of them have not been exercising, have not been working on their normal core kind of strengthening things that they do in their day-to-day life that's been reduced over this time. So I think ways that we can help with their strengthening and conditioning as they start to increase their activities are going to be very, very important.
And what are some of the good options for older adults to keep active?
So great question. They can do it in their yard. They can do it by yard work. They can do it by housework. They can do it by having some chair exercise programs. We have put together at our senior community centers, our Optum Care community centers, exercise programs like Tai Chi, line dancing, Wii bowling, different programs that are designed for balance specifically for our seniors. And at our lifestyle centers, we've really designed to make sure that we've taken safety into consideration as people are coming out of their isolation. So we're really doing our best to reduce the risk to exposure. And those aren't just available to our patients and our patients that are in Medicare Advantage programs, but they're available to all of our seniors in the community.
That's great. And I think you mentioned gardening. Let's talk about those non-sports related or non-dance related activities people can do.
So I think that that's important. A lot of people, exercise is a bad word, but if they can just incorporate activity into their daily lives, whether it's going window shopping at an outdoor mall, or even do some sit to stand in the chair when they're watching some TV during the day.
Great advice for any age, actually, I would say. So let's talk about these older adults that might be afraid of falling during the activity. How dangerous can that be?
So falls is a big issue coming out of where they've been isolated and at home, and there's been a lot of literature in medical journals about fall risks as people come out of this. So really looking at their home, making sure they're keeping their home safe, working on those core muscles, again, that strengthening in the legs and abdomen to reduce that risk of fall. Realizing that things like ladders, steps, uneven surfaces increase the risk of falls, making sure they have good lighting throughout the house and that they're not allowing things to be left on the floor that they can trip over, like lamp cords or throw rugs, or even a spouse or family member that tends to leave their shoes on the floor or their clothes at the side of the bed. Trying to eliminate all of those fall risks that are important.
All right, thank you so much, Dr. Rose. Southwest Medical Associates have locations across Southern Nevada. You can call them on that number right there on your screen, or just find them online at smalv.com. Las Vegas Now will be right back.